But first of all, introductions, and just as humble as you always are, you have just Matt as in your name. Not Dr. Matt Ritter, not Matt Ritter, specialist, surgeon, any of that good stuff. Uh, so I remember I met you when you came and did our first surgery here. Most likely, we know what the surgery was, as it is probably, I'm guessing, your most common procedure. But we met you back when you were just doing mobile, and I think it was just you in the Charlotte, and we're in Concord, but in the Charlotte area. And I don't remember how many years ago was that. Do you remember when you came to Charlotte?
Yeah, first started working in around 2014 on mobile, um, and I think you guys it was fairly early into that. I think I met Mo initially,
Right.
but I can't remember exactly. It was probably around 2015 or so.
Yeah, pretty early on. And in your background, you did not grow up like I did in North Carolina. You grew up somewhere
Yep,
else.
back in the Midwest. Yeah, I grew up in Iowa, uh, born and raised there, and did undergrad and vet school at Iowa State.
Iowa State, and you guys have a pretty good football team this year from what I'm seeing.
Yeah, well, that's what I hear, but when I was there, it was quite the opposite, actually. I know there was a season where they lost every single game. They were like 0 and 13 or 0 and 14 or something like that. And the following season, on the second game or something, they beat I want to say Baylor or something, but it was like 15 straight losses, and when they actually won a game, everybody stormed the field, tore down the goalpost, walking them
Just for
down.
winning the game.
Yeah, just
Yeah.
for winning the game, tore
Well,
down.
NC State's been through some ups and downs since I've been there too. My son went to Clemson, so I pull for them now, and they were supposed to have a great year this year, and it has been in the tank, so it's been interesting. It'll be cold. I'm going there on Saturday. We'll see how they do against Duke. But so
Oh,
when
all
you
right.
when you grew up in Iowa, I mean, how did the veterinary bug take hold of you way back when?
Yeah, you know, I always had an interest in veterinary medicine, or at least caring for animals at that stage. And early on, I volunteered at some veterinary clinics and just clean kennels and stuff like that. But um, I remember there was one time when I was pretty young. We lived out in the country in Iowa, and so it was mainly large animal. We didn't live on a farm, but we lived out in the country, and there was definitely a different mindset on caring for pets, and there was a lot less. At least in my region, there was a lot less. Uh, we just didn't treat them like we do these days, as far as family members. They were outside, and that's what. But I remember my dog had a swollen elbow. We went in, and it was. I actually think it was a fungal disease in the bone in the elbow, but it was unique that my I was like, Dad, we got to biopsy this, and so kind of really hoping that he would let us do it. And I remember they charged $100 and let me watch the biopsy. And after that, I kind of had the bug, um, but as far as like determining going to vet school versus anything else, I was really kind of looking at med school versus vet school, and the biggest thing that kind of drew me in is that I wanted to be a voice for a patient that didn't have a voice, and so I felt like I either needed to be like young pediatrics or animals, and so I ended up heading down the animal route um, uh, there, and it's a great decision.
Yeah, so I find it interesting that one of your memories is your own pet when you were a kid. I remember looking back now, like my favorite dog when I was growing up was this Doberman Pinscher, And I remember taking her in, my dad taking her in when she couldn't get out from like under the house. And like you said, back then, similar, I think across the board, the way pets are perceived now versus 20, maybe even 10, 15 years ago is completely, not completely different, but it is definitely scaled up a lot from back then. And we ended up, putting her down. She couldn't walk. It was and at the time it was like, well, probably cancer. What it like they didn't really know. And now knowing what I know now, I know probably exactly what that dog had, and it rotates through
Hmm.
your mind. But those things in those certain formative years play a big role in our thought processes as we go forward. Um, but surgical specialty, and did you do your surgical specialty at Iowa State too?
No, after vet school, did an internship at University of Pennsylvania in Philadelphia, and then residency at Michigan State University.
Cool, cool. Had you always been like gifted with using your hands? Did you grow up like in the rural areas? We were always tinkering on stuff and trying to get things to work that don't work, or taking things apart, and we always very
Yeah, yeah.
lean
So
that way.
the I think the reason we went with surgery, we've got a little unique situation in our family, where my two older brothers are human orthopedic surgeons, and my younger brother is a dentist, and we're all very handsy there. But I think the where that came from, my grandpa was a carpenter, and every time we would go to visit him, I mean, no joke, he would say, "Boys, head downstairs. Don't cut off any fingers." And he would give us a project. And so we'd all have to go make a sword or go whatever. And so, right from when we were real young, um, uh, he, uh, he had us building things down in the shop. And so we all to this day love to woodwork. Um, and so I think that's actually, orthopedics is very hands-on, very woodworking like, and so
Yeah,
I
yeah.
think that's where that came from, because we saw it in my three brothers as well.
That's that's so interesting and cool that you had that experience at a young age, and your grandfather was a carpenter. That's pretty
Mm.
awesome.
Yeah.
So, how did you end up in North Carolina? You went from Iowa to Pennsylvania to Michigan. That's a lot of areas up here. How did you end up down here?
Yeah, yeah. No, I never in a million years would I thought I was heading to the Carolinas, but after residency or during residency, I was interviewing around, and there's all these connections from people that have been through Michigan State, and um, I was interviewing at a place in Pennsylvania in Pittsburgh, and and the place I was interviewing, there was a surgeon at Michigan State that worked there 15 years ago, and they're like, "Hey, you need to touch base with this guy to get some background on this place you're going to visit." And so I gave that guy a call, and we just honestly started hitting it off on the phone. Um, and he said, "Hey, we're actually not looking for a surgeon right now, but why don't you come on down and visit the place?" And so I went down to. I was in South Carolina. The practice was in South Carolina, and so I went down to South Carolina and interviewed, or actually just hung out with them. Met everybody, and honestly, it was just like home. And so we just had we hit it off very well. Practice was awesome, and he's like, we like I said, we don't have a spot for you, but we'll make a spot. And so we came on down, and that's how we got down to Carolinas. From there, I worked there for 8 years. It's a great multi-specialty hospital. Did a ton of neat surgeries, neat clientele, and at that stage, our family was kind of growing, and we were at a spot where a lot of kids. We have 8 kids now, and
Big
uh,
family.
So I've got, I call it a disease. I can't leave work unless everything is finished. All biopsies are called, all owners are called, everything is tucked in. And so I was finding that I was working, 12, 14-hour days pretty regularly. And, seeing there were times where I wouldn't see the kids awake, for 3 days. So I thought, well, I got to look at some other options here. And at that stage, started looking at, there were a few people across the country that were starting to do some mobile surgery, and
Yeah.
started looking into that model. And at that stage, I felt like that was going to create a little more freedom there, schedule wise. The hard part is that, back in the day, in South Carolina, I think there was a total of 8 surgeons across the state. And so the non-competes were pretty stiff. And so I think my non-compete was 2 years and 5 counties. And so the only way I could practice is unless I moved, is to drive. And so I started doing mobile surgery in the Charlotte region, and actually started doing some in Columbia, South Carolina as well, so I could get out of the non-compete range. But that's kind of how we got
Yeah,
to North
that's
Carolina.
some interesting stuff to try to navigate. That's pretty much inside baseball to a few different industries. I think legal may deal with that, but definitely the veterinary world, it is something that keeps coming up as a question mark as to how that's going to hold up over time, which we'll see. But now you actually have grown to how many doctors, and you have a physical practice too?
Yeah.
That's
So we,
impressive.
yeah, did mobile for about, let's see, I guess it was about 6 years, and then we opened bricks and mortar. Um, and so we've got 4 surgeons at the bricks and mortar, and then an urgent care doctor that helps with more of the urgent surgical caseload as well. So there's 5 doctors in the bricks and mortar, and then I do the mobile side still on the road.
And that is Bedrock
Yep, Bedrock Vet
because you're a
Specialist.
big fan of the Flintstones.
Nope, that was quite a topic there, but yeah,
Yeah,
Bedrock
that's
is
hilarious.
we use that. We picked that name. Our logo's got like 2 lines. There's a B in it, and there's 2 lines in it, and the 2 lines are basically stand for the 2 things that I felt like were the foundation. Basically, the people, and then the product. And our focus is on getting good people that have really high quality character, and and then those that are also very meticulous on the product. So we want people that are nice, kind, conscientious, um, and those that have great set of hands on them and do a great job. And so those are
Well,
the bedrock from which we want to grow.
everyone at your practice that I've ever dealt with has been top notch. I mean, your
Yeah.
reputation has only been increased by the people that you've surrounded yourself with. And I will tell you, the very first time there's a guy that you mentioned that's my partner, Dr. Ahmad. He's hard to impress from a surgical standpoint because he likes surgery. He did surgery internships. He was like our vet school classes surgery award winner. I happen to be the internal medicine one of
Yeah.
those where so it's funny we came together.
Yeah.
But
That's what
surgery is he loves surgery, and when he saw, he was like, that was impressive with your efficiency and ability and how quick you were able to do the surgery, and it was like perfect. He said, I cannot even make a case for me doing it was mainly, I'm going to let the cat out of the bag, which everyone knows is your most common surgery, I'm sure, is
TPLO.
the which is when you tear your analogous to the ACL in humans, a very common injury in dogs. That's got to be your most common surgery, and that's mainly we've seen you here for that quite a bit. But the way that he was impressed, and then I got to meet you and your ability to not only do the surgical stuff, but also talk with the owners and let us know how to do the follow-ups. It's a difficult thing to match with the practice from with everything that you were able to do, and we were just blown away. We're like, yep, he. Not only were you great then when you became Bedrock and grew that out, it's just been impressive to watch you from when we first got to meet you to be so impressed with you to then see your growth and your family growth and everything else. It's been absolutely amazing. So, do you have a most memorable case that's maybe not a TPLO
Hmm.
that sticks?
I mean, there's a ton of them. There's a ton of them out there. I know there was Lucy. Lucy was a younger black lab that got hit by a car, and um, it's just one of these situations where um, uh, contemplating euthanasia, but there was one leg that I won't get too into it, but one leg required amputation. The other leg had a femur fracture. The pelvis was broken. Um, the abdominal wall was ruptured. The spleen was ruptured. Um, and there were huge soft tissue injuries as well. And so it was just one of those that required probably um, a staged procedure, probably about 4 surgeries, and then a final skin graft or a skin flap at the end. And so that was one of the longer management cases, but a lot of fun, awesome owners and family, and so it's just fun working with them through all that.
Yeah, and when you have a case that has multiple layers like that, not only does it take your technical and medical and clinical expertise, you really get to know those people because they're there all the time for something different, and you get quite a connection with the owners, and to go through all that, they definitely have a significant relationship with their pet to go through each of those steps. So yeah,
Yeah,
I bet Lucy will stick with you for a long time.
yeah, you
Um,
bet.
so a couple final questions for the pet parents out there. I'm sure you do enough of the TPLOs that you would love to give them any best advice for the ligament tear and the injuries. I've had a right ACL. I can tell you, even with the best surgeons, it's never the same. So, as a surgeon, what would be your best advice to avoid the surgeon and to protect those ligaments? You do the most with them. What would you tell folks?
Yeah, I think the biggest thing is keeping your pet slim, trim, and in good shape. Um, we see there's a lot of different reasons or potential pathologies, etiologies as to why these ACLs tear. Some of them are within our control. Some of them are outside of our control. But I think the baseline thing, and I think the same thing for human health is, um, a good diet, but staying active and staying thin and trim. Um, but the weekend warriors, where those ligaments are resting all week, sitting on the couch, and then they go out and do crazy stuff all weekend. Um, I think just consistent activity is a good thing, keeping everything tight.
Consistent, moderate, and keeping weight control is huge in our patients, and a lot of that, as you said, mimics exactly what you would hear from the human side of, hey, if you want to protect your ligaments, stay away from being sedentary all week and then deciding to go play 3 hours of pickleball and tennis type movements. I think there's a whole world of chiro and surgical and all these stuff that are basically the 50 to 70-year-old pickleball
Yeah,
injuries now,
yeah.
from what I've heard. Um, so, what is something that the general practitioner or pet owner world has a picture that you do that is potentially incorrect? For example, for us, in the GP world, it's like, oh, you get to play with puppies and kittens all day. And it's like, hang out a day with us in the small animal general world, and you'll quickly see that that is far from the case. And that's why we encourage students to go work at a practice and see some of the behind the scenes stuff before they just want to become a veterinarian because what's in their head doesn't match what's real life. Is there anything in your world that, we all think is one way? It's like, that's not really quite the case.
Um, Gosh, I don't know that I've got a good answer for you there. I
And
think,
that's fine too.
yeah, I think some things that, we'll have some human surgeons as patients, as clients sometimes. And I think they'll come in with the thought process of like, this is kind of a doggy surgeon. And, um, I think that a lot of them leave like surprised that, oh, um, it's, they're using the same equipment I'm using. They're doing some similar stuff. And so I think that
Their eyes get open to how
it's
advanced it really can be.
yeah, I mean, it's there's some neat things in veterinary medicine that are really advancing, and um, uh, I do think definitely on the human side there is, they're like the very very front of that cutting edge, and then a lot of times we're trying to adapt those things into veterinary medicine. But I think a lot of people are surprised at how far veterinary medicine has come.
You you made me think of something. I saw a reel or whatever. It's like a short, maybe it's a 1 minute thing, and Matt Damon was talking about a cat that he had from either Costa Rica somewhere where he brought the cat back, and the cat ends up with a brain tumor, and he's talking to he's on a talk show, and he's like, "Oh, you wouldn't believe it. We took him to like a veterinary neurologist. Like they have him like it was the craziest thing ever. Like, yeah, Matt, we have a vet neurologist." And he was just blown away. That was a thing. We're like, really?
Yeah,
So it was interesting to see from that standpoint some of the things that even the people with plenty of means don't really know. Um, okay, last one,
yeah,
surgeon temper. I had a classmate when we were in vet school who went to work for a human surgeon in a hospital because his dad was a OBGYN. So he got in there and he was basically handing instruments, and he had witnessed the surgeon when they were handed the wrong instrument, that the instrument was either dull or they got the wrong one, and it came flinging across the surgical suite with the surgeon temper. And I've heard of this, but I really don't imagine it in the veterinary world surgery suites. Has that ever been a thing? Have you ever seen that in vet school stuff or whatever?
yeah, absolutely.
Oh,
Uh,
okay.
yeah, absolutely. It's you know, it, the other stereotype is the overconfidence from surgeons, and just kind of the cockiness. And I will say that surgeons, the position kind of selects for people like that, because it is something. If you can, if you need someone that can be like, yeah, that dog's heart valve is faulty. I can go ahead and replace that. It's kind of crazy. You're like, but you need someone who um, thinks that they can do things so it somewhat selects for those type of people. But there is a good balance in there where you've got someone who's confident yet humble, and that's the combination we look for on when we are interviewing. But as far as the temper goes, again, we don't see it in our practice, but I've definitely seen it,
I
and
won't
it
have you
happens.
name names or anything, so
Yeah,
it can actually happen in the veterinary
it
world.
it actually
Well,
happens, and there
yeah.
are 2-year-olds and 50-year-old bodies. So
All right. Well, I was thinking you were going to say about the thing that we wouldn't notice or that we think more of a surgeon is that I've had some cases with some of your guys at Bedrock, and we had a parathyroid gland won't get into details, but that is involves a lot of internal medicine combination with it. So what I was thinking you were going to say is that as opposed to human surgeons, you have more of a full case balance,
Mm.
and you have to still not just cut and paste things together and you have to also keep some internal medicine brain. One of my clients he's a wonderful human surgeon, but he's basically, he's in the surgery, and then once that case moves out of his surgery suite, someone else does all the other stuff. And I would think in the veterinary world, you still have to keep your fingers in the medicine side a bit too. You can't completely cut it off, which is better for your
100%.
brain, maybe.
No, it's
But
100%
that's
true. Yeah, I will say that when I talk with my brothers, we're having conversations about things and they're giving some advice to my parents. And sometimes I'll just be like, hang on, it's like, so,
yeah.
but yeah, no, definitely you have to, you don't have, especially in our practice, we are surgery only. And so you don't have an internist, you don't have a neurologist, you don't have, dermatologist. And so you definitely need to stay up on some of that stuff and then certainly seek help when you need it.
Well, man, I learned something new I knew about your family, but not your family like your
Yeah.
brothers. That's your parents have to be like crazy proud. You've got like your Thanksgiving conversation has to be you've got two orthopedic surgeons, you've got you and a dentist. That's like wow, that's a bunch of brain power, buddy.
Yeah, I don't know. I think it's I wouldn't necessarily say it was brain power. I think we were taught work ethic pretty young. We heated our house by wood, and so it was when we grew up, and so it was work ethic. I think that my dad really and so we worked through the lack of brains by sweat. But anyhow, yeah, no,
You're
it's
very
fun.
humble. I know I took those tests to get in and out and through vet school. You may get to work on, but you got to have some of it. So, well, I know that you're probably getting ready to head into another surgery, go fix another uh, puppy dog up so he's running again. And we've been absolutely amazed and grateful for all your care for our patients here. And we'll be seeing and talking with you quite often. Thank you so much for your time with me today, Dr. Matt Ritter, owner, operator, surgeon, still doing some mobile stuff all around, and 8 kids. The Christmas list has got to be really long for your family. Um, but thank you so much, and I appreciate it. And we will let you get to your day of fixing them up.
That sounds good. And if I can say one more thing, I do think that it's guys like you and Amat that, I do a lot of driving because I live about an hour and a half away from Charlotte area, and we still live there. But my intent initially was to go back into the region that I was. But what kept me on the road and doing mobile up in the Charlotte area were the quality of veterinarians and teams that I was able to work with on mobile. And so that is something that I thank you guys for creating that environment on there. So it's definitely enriched my life through all of this. So that's something I'd like to thank you guys.
Well, thank you very much. We've definitely appreciated the partnership with having your wonderful hands in the hands of our patients, and we do take that very seriously. We vet out quite a few folks. We finally got like the combination of the ones we like to do the ultrasounds and the surgeons. So we definitely appreciate you and thank you so much. Thanks
Absolutely.
for your
You
time
take
today.
care. Thank you. All right. Bye bye.